This clip is sponsored by Med Travelers. If you're an SLP interested in travel therapy, visit medtravelers.com to get started. But back to this current research, how will the results of this, how do you see the results of this impacting speech pathologists' work with a better understanding of language in children?
That's a great question. And I think that's something many SLPs probably have, right? Is, okay, that's cool, but how does that help me do my job? And I think for this particular line of work, I don't think I'm going to have a finding where I can say, okay, now you have evidence for such and such an approach in therapy. But what I do hope to do is contribute to our understanding of, for kids who have below average language, what's going on there? What's making their language different from the kids who are successfully using age-appropriate language targets? And so maybe I can contribute to our understanding of prediction in children with language disorders. And so if we learn that they're not making the same kinds of predictions that their typically developing peers make, we can think about, do we need to what areas might we want to consider strengthening? So it wouldn't tell you definitely do this, but it will contribute to our understanding of what language disorders are, which I think is a really necessary foundation for the follow-ups of, okay, now how can we improve treatment?
Yeah, and I really love what you just said, because I feel like with language disorders, sometimes it's so ambiguous. And that's where what you're saying too is bringing me back. I'm having a full circle moment, Kathleen, is like that detective piece, because I feel like having information helps you more, like you said, it's, what compensatory strategies, what do they need? What could I do to help this happen? And so the results of this could really give us a good understanding of that, especially in this younger population, which many SLPs work with that are often, identified around this age or earlier. So I think it's so important, because I think sometimes too within our field, a lot of things feel ambiguous. And so even having some knowledge about, we know this at least, so that can help us at least get started. Right.
It can help target your observations with a particular child as you're doing that detective work. I don't think we're ever going to be able to give you just a cookie cutter flow sheet. There's always going to be that element of, what do I know about the foundational sciences of language, and how can I apply that to what I see in this child? Because, every child is different, even for things that are extremely effective, we don't say, do this to everyone all the time.
Yeah. And when you're doing, collecting, the participants' information, do you just report it as, in your findings, this percentage had an identified speech and language disorder coming into this? I mean, is that notated so that when you're looking at the results, it's easy to see this group did this group did this group did this?
Yeah, so that's one way I'll report it, which is these are the kids whose parents said they had a language disorder. These are the kids who didn't. I also administer some of my own assessments. So I can also say, just show like, here's the distribution of scores on the PPVT. And maybe color code that chart for the kids with disorders and kids without, because what I am hoping is that I get a whole range of abilities rather than this, this group down here and this group up here. I realize gestures don't come across, but I'm trying to gesture.
There is YouTube. You can go to YouTube and you can see all of Kathleen's gestures.
So another way we can do that kind of two group analysis like you described. There's also statistical methods called regression, which lets you predict one thing from another. So maybe instead of splitting them into two groups, I could take their language scores and see if I can use that to predict the percent of the time that they did the silly response as opposed to the adult-like one, right? So if one kid had a score of 115 and had 20% adult-like responses, and someone else has a PPVT score of 75 and 80% adult-like responses, we can look at that continuous relationship too.